Good afternoon, everybody. Today we're going to go over adult CPR. This is a skill if you find a person, an adult, that is not breathing and has no pulse. We'll also go over child because it's a very similar skill. If you find a person that is unconscious for unknown reasons, you're going to check for consciousness.
Are you okay? Are you okay?
If you have no response, you're going to call for help.
Call 911.
Then you'll open the airway, look, listen, and feel, and find the pulse. You're going to look down at the chest, see if it's rising and falling, listen to hear the breathing, and feel it on your cheek while you're finding the pulse in the neck. Do it for no more than 10 seconds. If you have no pulse, no breathing, you're going to start off with compressions right in the center of the chest, just below the sternum, at the lower half of the sternum. You're going to keep your elbows straight, your shoulders right over your wrists, and do 30 compressions, compressing at least 2 inches deep. Then you'll do 2 breaths. If you have a CPR mask with a one-way valve, that's the best way to prevent disease transmission. And then you'll go back to 30 compressions. If you do not have a CPR mask, you can use any type of barrier, which is better than no barrier at all. You can see it has a piece of cloth that's covering and then does mouth to mouth. Okay, and then you go back to 30 compressions. With an adult, you would not stop until EMS arrives or someone of equal or higher training takes over. So you continue with 30 compressions and 2 breaths until help arrives. Okay, so now we're going to talk about the difference between adult and child. You're going to check for consciousness the same way.
Are you okay? Are you okay?
You're going to open the airway and look, listen, and feel and check the pulse the same way. If you have no pulse, no breathing, you're going to do 2 minutes of CPR, 30 compressions, 2 breaths. The only difference between an adult and a child is you're not going to compress the chest as deep. If you have a very small child, which Connor will show you in his second round, you will use one hand and the other hand stays on the forehead, keeping your shoulders square and your body balanced. But if you have a very small child, you would use one hand, doing 30 compressions. With a child, you want to compress the chest about 2 inches. An adult, at least 2 inches. For a child, you would do 2 minutes of CPR. If you were alone and 911 has not been called, then you would call 911, come back, and continue. Because remember, a child's heart stops majority of the time due to an injury, choking, getting hit in the chest, or near drowning, which can be helped with CPR. I hope this helps you, and we look forward to helping you with some more videos, and have a great day. Bye, Connor.